time. Just so you know, like people should be able to see you. All right. So I'm just going to check. Okay, we should be live on Facebook, LinkedIn now. Good on YouTube, we're good on Twitter, good on Twitch, and we're on Daily Motion today. Okay, and now we're good on Instagram. All right, perfect. All right, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Lawrence Doan, and tonight we are joined by two ADSA representatives. We've got Joanne Lin and Kai Lin Shi.
Hello.
Hi.
The Australian Dental Students Association, ADSA, is the only national body to represent all dental and oral health therapy and hygiene students in Australia. ADSA aims to foster communication between the various schools, support its members through their course, and keep all the dental students informed of issues affecting their student life and the dental profession. So, Joanna Lin is the president of ADSA and has had the opportunity to participate and organize various dental volunteering activities and work at dental clinics as a student. After she graduates, she's interested in undertaking volunteering opportunities in areas where her dentistry skills are needed the most, COVID permitting, of course. Kylin is the vice president of ADSA. A jack of all trades, Kylin is heavily involved in dental, marketing, and design industry. He undertakes projects with the aim to share his talent and produce meaningful work for the community. Kylin is driven by his love for learning new things both within and outside of dentistry. Joanna Lin and Kylin Chi, welcome to the show.
Thanks, Lauren. Thanks for having us.
So you both have very different interests in the field of dentistry. So let's start with Joanna. Talk to us about your interest in volunteering and how that kind of came about.
Wow. I guess it started when I was in grade 7, really, and my first volunteering activity was through church. And it just grew from there. I mean, I have a really good appreciation for service, and I think it's really important to give back to the community in every way we can. Really, it's just as simple as that. You don't really need very special skills. What we did last year was, or the year before that actually, COVID has just warped my sense of time. What we did was we, as students, went out and did some oral health promotion, and we gave some oral health advice to students and also to women and other people in different institutions. That was a really good experience, and I think also my dental volunteering sort of came about around that time when I went to Vietnam on an overseas dental trip, and that was just an amazing experience that I'd love to go back again or go to somewhere else that really requires that service once I've graduated, of course, once I have the skills to actually perform dentistry. So yeah.
You were actually the Red 25 coordinator, was that right?
Yeah,
for
that's
Red Cross?
It was through ADSA that I was responsible for organising this blood drive for La Trobe. That involved, promoting it relentlessly, organising transport, booking the individual sessions for people, and organising information sessions as well. That was a very hectic couple of months, but we ended up having the most donations out of all the dental schools across Australia. So that was a really good experience.
Nice. Now, Colin, I'm not going to forget you here. You were a volunteer at the Australian Dental Foundation, was that right?
I was, yes. I've been similar to Joanne, I really enjoy, volunteering and really enjoy giving back to the community. So since about last year, during, it was in between COVID, I thought that, I should probably use some of my time and really, do something meaningful with it. So I volunteered with the Australian Dental Foundation, and they're very lucky to have a Victorian branch where I was able to reach out to primary schools and aged care as well, and we were able to give out some oral hygiene, talks, some education, also have some of the dental outreach programs, which has been it's been really nice.
That's great. It's always nice to give back. Joanne, tell me, what year are you in?
Actually, Kylan and I are both in the same year at La Trobe, so second last, which is fourth year for us.
Right. And is there any particular interest in the field of dentistry that you're particularly interested in?
I am loving all aspects, to be honest with you. We recently finished our course on endodontics and fixed pros. So even in our second last year, we've still got a lot to learn and a lot of experience to gain. So if I had to choose, I think general dentistry is the one for me. I'm also interested in ortho, but I do know that, as a general dentist, we have a lot of variety and we can do a lot of things. So that's probably where I'm staying put for the time being.
Fair enough. Yeah, there's probably so many things shooting at you right now. It's all new and fresh and it's all exciting.
Yeah, that's right.
Yes. So over Kylan, you say your interests lie in dental marketing, design. Tell us a little bit about that.
That's right. Yeah, well, that's kind of how I really got into ATSA, really. I'm a little bit of a nerd when it comes to designing. I've always enjoyed designing and graphic design. So in first year uni, I got around designing some stuff for the student society called BODS up in La Trobe for Bendigo. And then since then, I've pretty much, just started designing for everything. I've designed for the uni, was lucky enough to be on the design director for ATSA in 2019, 2020. And then that's brought me here today to the vice president of ATSA. So it's an amazing journey that I've embarked on with design. I think there's definitely a lot in it. I know that having designed for a lot of the student associations as well as worked with a lot of dental clinics, design is really getting there, and I really enjoy kind of marketing and designing products for clinics and for oral health promotion as well. I think it's fantastic.
Right. So maybe are you hoping that when you graduate, you might diversify some of those skills to outside of dentistry?
Yeah, absolutely. I think it's just something fun to have on the side, and if it keeps me busy, I think it's something that I'd love to delve into and see what's out there for me.
Yeah. Were you a design officer for VSA, the Vietnamese Student Association, at one point?
I was the design officer for VSA in 2018, I believe, 2017, 2018. I don't know how you found that out. I'm trying to keep it on the down low. But I was, and I really enjoyed working with him. It was really fun.
Yeah, there you go. You might not all be about dentistry there. So what are your particular interests in clinical side of dentistry,
Oh, that's a great question. I've been kind of bawling my head out with this question. I think it's really difficult for us students to answer that because we just don't know what's out there. I mean, like Joanne said, we get bombarded with things here and there, bit of oral surgery here, bit of orthodontics there. So that's where I think, a lot of kind of looking out and learning kind of comes in handy. For me, I'm still not too sure. I definitely enjoy the patient factor. I love seeing patients every day. I love communicating, trying to problem solve, and I think that set me up really well in terms of practicing dentistry. But in terms of specialty, what I want to focus on, I haven't quite discovered yet, and I'm really hoping that through learning, whether it be through the university or through even CPD courses, that I'm able to, find something that I'm interested in and really delve into it.
It's
good. Sorry?
No, I was just going to say, because we're still students, it kind of feels like year 12 all over again, where I both really didn't know what we were going to do at the end of year 12. And so it seems like history is repeating itself. See how it goes.
Yeah, look, hey, don't be too burdened by this question. I'd say that if you've listened to any of our previous speakers, they've always said how even after they graduated, they're thinking they were going down a particular path, but then they end up switching as well, or their interests end up switching along the way. So, it's don't feel like you have to pick one now, and don't be saddened that it changes or with time. So it's all good. So let's switch gears for a little bit. Let's get into the crux of what's kind of happening to many students at the moment. You guys are based out in Melbourne, but there's Sydney, there's Queensland. There's many student bodies that's been kind of hit by COVID, especially along the East Coast. And this isn't the first time for you guys. How has that spilled over to your learning experience from your point of view?
I'll start. So obviously, being a part of ADSA has given us a different kind of perspective on this whole situation. When it was last year, kind of we just had to deal with it, by hand, and we were quite upset, obviously. But now, overlooking the entire kind of Australian dental cohort, it's quite frustrating, as well as it's quite sad to see that a lot of students' experience is getting limited from all these restrictions, and it's challenging for everyone. It's not hard to identify that, I think for me and Joe, I think we're just fortunate enough that the university has given us opportunities as much as they can to have our clinical placements, and we know that universities around Australia have been doing the same. But when it comes to international students, our members from Canada and our members from Singapore, it's much more difficult for them, and that's something that we still try to problem solve and work around every single day.
Yeah, that's true. We have a lot of, just talking to the representatives from other universities, it seems like this year is definitely not as bad as it was last year. We've had a lot of clinic time cancelled last year, and I know that our student society cancelled all of their in-person events, which was very shocking.
Yeah.
It was just, I think we are getting a lot better and more hopeful as well, which is why we're able to plan for a convention in Melbourne in person this year. But Kylan and I have seen, the effect that this has had on students, and that's why through our programs like Dentists for a Day, we're hoping to give more clinical experience, or hoping to add to that clinical experience of students.
Yeah, okay, so let's talk about that Dentists for a Day program. You started a few months in April, June, and now you're going for your second term with that. And you followed that up also with an oral health mentor program as well, is that right?
Yeah, that's right. We thought it would only be fair because we have actually been running a very successful ADSA mentoring program for dentists. Kylan, do you want to speak a little bit about that as well?
Yeah, well, so I think, what we found during lockdowns was that a lot of us haven't been getting the experience that we really wanted. So what we've done is we've reached out to our the broader dental community. And we're very fortunate to have such a welcoming community. We have many dentists that have come on board to support us through, the Dentists for a Day program, as well as a graduate series, a program that we're running as well. We have, a lot of professionals give us some advice on the graduating cohort. So it's been fantastic that we're able to get the support from that, and we really want to see that to be to live on in ADSA for the future years.
Yeah, I think that's a good initiative. You guys have also started a health and well-being blog, Finding the Balance. Tell us a little bit about that.
Yeah, well, last year at the start of lockdowns I remember this like it was yesterday actually. It was middle of March. We were just sent back home on the Friday, and we were told not to come back until further notice. And for that entire week, I remember sleeping really, really late, waking up really, really late. I had no kind of rhythm whatsoever, and I knew that I wasn't alone, and all my friends were pretty much similar, because we'd play games all day and we'd realize that everyone was online at 2-3 a.m. in the morning. which was not a healthy way to cope with COVID. That I learned the hard way.
Your students.
Yeah, with students, exactly. What I kind of brought onto the committee was that, I think it'd be a good idea to offer some advice. And we all have different ways of coping with certain things in terms of, health and well-being. And we thought, why not have ADSA as a platform where we can all, help each other out and see if there's any ways that we could adapt some rhythm in our life and really make the most out of it. And since then, we've had this blog come into existence, and it's been fantastic. We've gotten some really fantastic feedback from it. And personally, as me, alongside with a lot of my friends, we found ourselves, going on runs really frequently. We've started doing some fitness sessions. There's a lot of great content on YouTube that's out there, and it's kind of like our little weekly ritual now, which is really good. So even without any restrictions or any COVID, we're still looking after ourselves. We're still staying nice and healthy, and I think that's what's good about the health and well-being vlog. Yeah.
That lifestyle, and what's also really good about it is the member interaction, because each time it takes it from the perspective of a different student, and so they get to share what they've been up to or what tips that they'd like to share with the rest of the Australian dental students.
So you mentioned fitness. Joanne, are you going to give us some boxing tips?
Yeah, definitely. Yeah.
Okay, so yes, you mentioned, like, compared to last year, you guys tried to facilitate for student experiences. You had the convention last year, and now it's being held at the end of the year this time. How are you guys going to do it a little bit differently this time?
So last year was all completely online, and I think that while that was a good way to sum up 2020, a lot of people are just, very burnt out over Zoom and using these online platforms just to do everything. We have decided to push our yearly convention to December this year, so that's 6 months down the track, in hopes that maybe we'll all be vaccinated by then, and there won't be any COVID outbreaks anytime around that period. We've had it in Melbourne technically last year, but it was more just purely online. There were lots of educational content and videos that we were able to share with the students, but it'll be very different this time, because this year we're having in-person workshops, social events and lectures that will be live and
Yeah, and I think it's worth it to give our wonderful team and our wonderful co-conveners this year, Peter and Angela, a big shout out. They've been really looking after the event and planning it for 2 years now. So we know that it's going to be a huge hit, and the ticket sales have been going really well. So yeah, really credits to them and their hard work. And they've had to be so flexible with everything, with all the restriction, the cancellation. So we really appreciate the hard work of our committee, and fingers crossed it will be able to happen this year, because it'd be a shame for more than 2 years of preparations to go to waste.
Yeah, 100%. Like, I've seen my friends reschedule weddings, and it's not easy rescheduling the venue at a different time, especially when everyone's booking out the time schedule.
Yeah, no. That's why, we are very grateful for not only our committee, but our members as well, just for being patient with us.
So what would you say are your favorite social media platforms at the moment?
The ones I definitely use the most would be Instagram and Facebook. I think it could be very different for a lot of people. Younger people would probably, like Kylene, would probably say TikTok. It's really interesting because you see a lot of dentists on TikTok now that are trending, as well as on Instagram, who just have a lot of educational content or behind the scenes to share. So it's really interesting. Even as a dentist.
I was going to say, how has that shaped your outlook on dentistry? And as up and coming dentists, how does that make you feel in terms of your mindset and attitude?
Well, I think it's really interesting. I think this is a kind of a new thing, and the reason I'm interested as well is because I have the interest in marketing as well and design and stuff. And what you see out here is that, you know, in for our students and for this new generation, social media is really changing the shape of dentistry. We had this discussion with Joanne just the other day. The amount of times that we spend on our phones is insane, you know. And just looking at my phone now, you know, we spend up to hours on Instagram, Facebook, and myself, I spend hours on TikTok, which is not healthy. That's something I'm working on. But I think that it's amazing. One part of it is that, you know, people get to share experiences. As dentists, you can see a lot of posts regarding cases that they've seen and discussions that they've made, which I think is really good. And another part is, you know, advertising and promotion for oral health for patients to see. And we see a lot of that through our social medias, our Instagram. And I think that's really good in terms of dentistry. But at the same time, there's also some things that we have to think about and have to watch out as well. But that's something I think we're yet to explore and yet to tackle. It's a whole new animal on its own. Yeah.
Look, yeah, that's such a loaded topic. We could talk for ages on this, just, you know, how dentists portray their work on social media, and it's it's a big issue, I think, for some, just also because dentists are, by nature, most of them are very perfectionist types, and so, you know, there is the danger of comparing our work to others. But if you take it more as a motivational something to strive towards, rather than comparing yourself to what the other person has done or posted, because we don't know the full story. We just see that image that's been posted on Facebook or Instagram. We just have to be mindful that we're not taking it the wrong way.
Yeah, look, I think it's always. I think it sounds like you guys have touched on both sides of online learning, but it is, I guess, becoming for us. I think the institutions are definitely falling behind in terms of understanding that social media platforms is where a lot of their students are consuming a lot of the content. They are, you know, on there a lot of the times, and if the educational institutions, you know, block that out, that's definitely something that they're ignoring and falling back behind on. One of the other gray areas, I guess, is this marketing regulation that the the dental board gets us on, and that can kind of be confusing for the students as well. You know, when they become a dentist, they tick a box when they register, and they don't realize what they're signing up for in terms of advertising and marketing. But definitely something to be mindful of. Yeah.
Yeah.
So, who would you say have been your biggest mentors or idols in your career path, and why? Because I know you both are dental assistants, right, at dental clinics, one of which is the same?
Yeah, that's right.
Have you guys learned anything in particular? I felt inspired by anything at work?
I think just having worked at so many different clinics, and with a lot of different dentists as well, a big thing is that, you know, no dentist is the same, or even remotely the same. So I think that is owing to a lot of, you know, CPD as well as their own personal mindset when it comes to practicing dentistry. So I definitely do see a lot of the dentists that I work for as role models. And yeah, it's just so interesting to be able to, you know, help with their clinical work and also be observing what they get to do in a day. It feels like, Kylan and I have talked about this, it feels like we're learning so much that we should be paying them rather than them paying us. Yeah, what's interesting is that each dentist brings their own sort of light to their work. And I had the pleasure of going to the ADX with Kylin, where we met a lot of different dentists and people from, inventors to presenters. So definitely it was such an eye-opener, meeting people who had founded huge dental products that were made for dentists by dentists. And it was a great experience, and it really encouraged us to try and progress in our sort of career and see where that takes us.
Yeah, I agree. I think Joanne said this multiple times. I think every different day, I've found a different person that I want to be when I grow up. I just feel like there's really a lot of talent out there, and it's really cool to see that it's really good to see that learning doesn't stop after we graduate, and you can always be a better version of yourself every day. Just having that attitude for learning, which I think a lot of us dental students have, which is really good, which is probably the reason we embarked on this profession in the first place. So it's good to see that learning doesn't stop, and it's also good to see that it's such a supportive learning environment. Everywhere that we've worked, we've had dentists that are more than willing to show us some cool stuff, and more than willing to welcoming of questions that we have, and I think it's fantastic that culture exists in dentistry, and we want to be a part of it once we become dentists as well.
That's great. It sounds like you guys have definitely found like a great mentor to work alongside, or mentors to work alongside, that are open to discussion, but they're also passionate about sharing their knowledge. Because I feel like at the end of the day, knowledge is one of those things, if you don't share it, there's actually no value to it. So have you guys done any CPD so far?
Yeah, I think I can speak for both of us when I say we've done a few. For me, my CPD journey is, still very much, we're at the start of it. It kind of blossomed during COVID times, when I saw that a lot of the CPD that was available was now available online and for free. And so definitely that was something that I wanted to check out, and just to see how CPD can, because we're in such a growing, ever-evolving profession, we know how important CPD is. And I think it's very overlooked as students, just because we do hear from a lot of, very well-known lecturers and dentists, and I think we take that for granted, that hearing these lectures for, I guess, that are included in our uni fees, it's such a privilege, because when we then graduate, we're spending all this money to hear from the same people, and I think, for me, a lot of my CPD that I've been watching, because it's mainly watching, is on communication, restorative dentistry. I've had a sneak peek into some ortho CPDs, but to be honest, it's more for the exposure. It's more just, the mind of an orthodontist, rather than to pick up every little tip that they're giving, because we haven't even started any sort of orthodontic clinical work. But it's just really interesting to hear from all of these different people who have so many, just a wealth of knowledge to share to us.
Time feels the same as well then?
Yeah, I'm quite similar. Actually, I'm actually quite surprised by myself. I used to be the person that would never go to lectures, so the fact that I got around CPDs was actually a surprise myself. I'm pretty proud of myself for doing that. This obviously happened last year during COVID, so I'm very, very similar to Joanne here with CPD. And look, I have to be honest, I haven't been to many, but the ones I've been to, I loved it. And I'm in the situation, in the place now where I'm really looking for more CPDs that I could do. It's just amazing how the way that it's structured, some of the case discussions. It's amazing. And been to a few on occlusion and fixed pros, and I think it's been really helpful. And I've been able to, or I've tried to incorporate some of it in the patient that I see in the treatment planning processes, and I feel like it's fantastic. It's really something that the students kind of don't really get around as much as they should. And I really want to be a big advocate for it. And I think through ADSA and a lot of the programs that we're running and upcoming, for example, the graduation series, I want to get the students around it. And it's understandable that not all the students have the ability to fork out a large sum of money to pay for their education when they're already paying for university fees already. But I feel like if there are people, if there are dentists and professionals out there that are willing to give a little bit of a discount or sneak peek to us students, we'd be more than appreciative of it. And in the future, as we do start working, I'm definitely looking to some good courses and some good CPDs out there to really fulfill my interest and my learning in.
Yeah, I mean, I definitely remember the days when those teeth, those that you cut into, were not cheap to replace. Those dental equipment are not cheap. So I can totally understand where the CPD and those discounts definitely come in handy. So tell us a little bit more about this graduation series that you've got coming up.
Yeah, I'd love to. So I've had the pleasure of organising most of it with the help of Joanne and our past presidents. So this series is coming up in about a week's time. And what we're having is basically 2 weeks of really, really good content featuring some big names in dentistry. And we really want to give the students some information on what life is like straight out of graduation. And I feel like that's something that we students not too kind of familiar with. Being in the the dental school, as well as having clinical placement in public clinics, it's kind of it's a big animal for us to look into, to tackle when it comes to finding jobs out there in the real world. So we want to have this week, we want to spend it with our members. We're going to have seminars running or webinars running every night from 6 p.m. And we're going to get some dentists, some companies, and some specialists to come speak to us and give us an insight on what's really out there and what to look out for when you're graduating from dentistry.
Yeah, definitely. I think it's a completely different oyster. You no longer have a set structure that you have to follow. It's pretty much the world's your oyster. You can do whatever you want. And for some people, when they've gone through high school, especially for students who've gone through dentistry, the aim was always to get high marks. Get those marks, and then you're into dentistry. Then when you're into dentistry, it's always about trying to be top or stay in passing and all of that. And then you've got that structure, and now you graduated, and it's like, do I learn about endo? Do I learn about ortho? Do I learn about all these different things? It can definitely be very overwhelming.
The gap between when you first graduate and when you start working is huge. And the grad series was actually something that was founded in the times of COVID, because we saw that these grads in 2020 would have an even bigger gap than their previous cohort. So we wanted to help with that in the only way we could really during COVID, which was webinars. And so it's just really, really valuable information that even Kylie and I, when we were in third year last year, really benefited from. Things that you have to know that really no one teaches you, or you might find out when it's too late. And so we just wanted to share that with our with our fellow colleagues.
What do you hope your in 5 years' time, ideal clinical or non-clinical day to kind of look like? And what do you want to do to kind of track yourself? Like, what kind of CPD do you want to do to get yourself there, if that's the case?
That's a really good question. Yeah, no, it's a really good question. It's something that I really enjoy looking into. I'm one of those people that frequently like to ask myself, what do I want to be? What do I want to be in 5 years' time? And what do I want to do in 5 years' time? And honestly, I've kind of accepted the fact that, wherever life takes me will take me. And I think that in 5 years, ideally, I want to be not in lockdown. I want to be out there, working. I want to be, speaking with patients, and I want to be, looking after them, trying to help them with whatever issues they have. I think I want to continue learning. I'm not too sure which direction just yet. I've quite enjoyed our back to base session with endodontics and fist prosthodontics, but I know that there's so much out there that I haven't even looked at. So my kind of goal is just to learn as much as I can, and look for opportunities, look for CPDs that I could be a part of, and when I find the interest or the opportunity, I want to tell myself to not be nervous and not be just to be confident and to take on the opportunity, and hopefully that puts me in a place where I'm happy with. And with my spare time, I'd love to spend it on volunteering, and as well as some of the marketing and promotional stuff that I like to do on the side. I think they'll really kind of I think that'll be the dream.
I think for me, I've got my eyes on some CPD courses in the future. Really looking forward to when we can start, hands-on workshop CPDs, because that I think would really be beneficial. As I said, also, I'd be really interested on doing more CPD on implants and fixed pros, and really just being able to have that full scope of dentistry available. I'm so excited for what the future has for both of us. So, yeah.
Yeah. Well, I mean, I think what you guys sounds like there's no particular, you don't want to specialize at this moment. You want to kind of just dabble in everything, and then maybe come back around and decide what you might be more interested in. Hey?
Yeah, that's it. I think that's kind of the goal for both of us at this point in time, at the very least. We've only had limited placement hours, which might be one of the reasons why we want to see kind of what's out there. But I think just overall general kind of treatment planning and looking after the patient is kind of what comes into priority, and what really interests us. So yeah, kind of going to the general stream and really understanding the fundamentals of dentistry before delving into any specialties, I think would benefit both of us at this point in time. Yeah.
Fair enough. I was gonna, as a previous ADSA exec, I'm super proud of where ADSA's kind of become, not just in size, but the initiatives you guys are kind of getting up into. From when I started, you guys were like, ADSA was very small. Now it's just like a ginormous family. So great work on that. What thing I would be probably interested in would be, I guess, if your convention doesn't end up being physical in person, you could always potentially maybe consider sending out kits to the participants, and then they could do an online virtual workshop. That would always be an interesting idea, I think.
Yeah, definitely. That's fantastic.
Yeah, that's a really good idea. I think it's among one of the ideas that we've been trying to put in place. Lockdown has really given ATSA the opportunity to explore new ways of engaging with our members, it's been a really interesting journey, especially throughout lockdowns. I think it would have been very different to how you had to look after ADSA. So we're excited to have new ways of engaging with our audience, and we'll keep you updated with what we're doing.
Sounds good. So Joanne Lin and Kylin Shi, both ADSA representatives, thank you for coming on the show today. If you could let the people know how they can find you, or if there's something that you want to tell the dental or oral health students out there, what's kind of going on?
You can find us both at the upcoming grad series. August 24th, I believe, 23rd till September 8th. Other than that, you can find us on the ADSA page. We are very active there, and if you have any questions or just want to tell us anything, feel free to jump onto our website or email us or connect any way you know how.
All right. Well, thank you guys again, and have a good night.
Thank
you,
you.
Lawrence. Thank you for having us. And yeah, we'll keep you updated. Thank you.
Looking forward to it.